Hi, everybody. I'm Lori Marie Peixoto, Executive Director of the Mental Health Association of Rhode Island. If you are a parent, a teacher, or a healthcare professional who serves children and adolescents, I have a new resource to share with you. MHARI has added a youth behavioral health liaison to our small but mighty team, and you're about to meet her. Joining me today is Laura Schenk. Laura helps Rhode Islanders navigate the sometimes complicated youth behavioral health care system. She provides guidance and virtual office hours for teachers, parents, families, caregivers, and healthcare professionals. And without further ado, please welcome Laura Schenk. Welcome, Laura. Thanks so much for being here today.
Thank you so much. That was such a warm introduction. I'm so glad to be with MHARI and happy to be talking to you today.
Excellent. Would you like to begin by telling us a little bit about your background?
Yeah, absolutely. I have my master's in social work, and what I think is interesting about that is I started off my journey being a recipient of mental health care in multiple different states in the country. And I went and got my social work degree and got my licensed clinical social work license after that. So I have kind of both of the user and provider experiences, and that kind of brought me to MHARI so that I can make it a welcoming environment and help people get the access that they need. So
That's wonderful. Thank you so much for sharing your story with us. What exactly do you, the Youth Behavioral Health Liaison, do? What do you offer? What are your services?
yeah, so I have found, personally, when I was a young person trying to find care, and then also as I got my degree and started helping other people, it is so difficult, especially for families of young people, to find the right place to go for behavioral health care. And there's so many different
Mhm.
options. Insurance can be difficult, and other social factors can be difficult, housing and food security and just everything that goes into it can get kind of overwhelming. And so what I do is I work, with families to say, okay, here's the barriers, here's what's difficult, and where do I go from here? Where do I start? Maybe I've already started, but that wasn't a good start. Where do I go from there? And kind of, work hand in hand with families to get that young person, that adolescent, into the right place. Because it can be overwhelming, and sometimes you just need somebody to walk that journey, that beginning steps with you.
So it sounds like, if I'm understanding correctly, a parent or caregiver who has some concerns about their child's mental health could approach you and say, I'm not really sure where to start. Here's what's going on. Um, and you can sort of pinpoint perhaps like what level of care they could approach. And then, of course, the clinicians at whatever that level of care is would probably meet the child and the family and determine if that's the best setting or perhaps refer them somewhere else. Is that right?
Absolutely. Everybody comes at a different point in their journey, and I'm not going to be providing clinical care. I rely on the providers to do that. So it's really, if somebody's in crisis, I'm going to tell them these are the crisis numbers that you can contact. This is what you can do in a crisis. If somebody is, more stable and kind of looking for something immediate but not crisis level care, then we can go that route. And the nice thing about Rhode Island and is that no matter where you go, the first thing you do with a provider is going to be an intake, and they're going to really dive deep into the clinical level of care that's appropriate. And so I will get you to that first step, and then the clinicians will take it from there.
Excellent. And to all the mental health professionals out there who might be watching this, or to perhaps the physicians, the pediatricians, if they have a child in their care that they feel could be referred out to a different level of services, could those professionals, those doctors, reach out to you and introduce you to the family member, the parents, and let you know where they should go, and then you would help the family make those calls and follow up? Is that right?
Absolutely. A lot of times physicians, for example, they have a family who needs some behavioral health care for the young person, but as the physician, they don't have the ability, the time to really give that family what they need in finding the right care. So they can reach out directly to me, let me know, hey, there's this family I'm working with. They need to go somewhere, but they have questions. Same thing with, if you're a mental health provider or if you're a teacher or if you're a school social worker or something like that, sometimes you need to refer out. Maybe you have a wait list and this person doesn't want to be on the wait list and needs something else. Maybe they need a specialist in some other area. And maybe they would just benefit from other, behavioral health similar resources like help finding insurance or something like that. So it can really come from anybody, the family, providers, physicians, anybody can reach out with any kind of questions.
Excellent. As you're doing your work in the community with professionals and family members and young people, what are some of the challenges that young people are facing today?
Yeah, I think there's a lot of them. It's kind of a turbulent time for young people. Um, as far as behavioral health concerns, substances continue to be a concern for a lot of teenagers, especially.
Mm.
Um, and then also just this pervasive anxiety that exists for a lot of adolescents and young people as they're trying to navigate a lot. Social media, especially increased demands at school, everything happening in the world. It's just can get to be too much. So I would say anxiety is a chief concern. Sometimes depression, that's up there as well as reports of depression are increasing. And then, they turn to substances to cope with those things. So those are the three kind of biggest things that I see right now, at least.
What should parents be looking out for?
So what I tell parents is, your child, and the biggest thing you can look out for is changes in their behavior. So if your child has consistently, gone to bed and slept well and woken up in the morning and gotten to school, everything fine, and then all of a sudden they're sleeping a lot and they're lethargic and they just like don't have the energy, that can be a sign of something, or the opposite, they're wired, they're never sleeping, they used to sleep great and now they're just awake with that insomnia. Changes in appetite, changes in weight that don't have another cause, being more irritable than they used to be, especially for our young men. That's a way that they express what's going on in their brains. So, you know, just any change that's not right for them. And then I would also say, just when you talk to them, believe what they're saying. If they're saying, I'm having a hard time, it's important to say, okay, let's talk about that. I believe you. What's going on? So.
That's great, Laura. Thank you so much. One last question. If a parent, teacher, healthcare professional wants to reach out to you to get some assistance from you, how can they do that?
So I like to meet people where they are. You can always contact me by phone, by text, by email, and also on MHARI's website, there's a form that you can go to. So at www.mahari.org, if you go to the About Us page and on the drop down go to Youth Behavioral Health, you'll find all of my information with a form that you can send to reach out, as well as my phone number and email if that's something that's more comfortable for you. Um, if you just have like a quick question or you just want to meet me before you reach out officially, I do have office hours that are open to anybody on Tuesdays at 5 p.m. and Thursdays at 10 a.m. And the Zoom link is on that web page as well. So lots of different ways to reach out. I encourage you to do so, even if you just have a quick question like, hey, I've never been to therapy. I'm nervous about sending my kid to therapy. what should I expect? We can just talk it through. And if it ends there, then great. And if we find a route for you to continue on with your kid, then that's great too.
Wonderful, wonderful. And one last question, or maybe just a teaser for our audience. I believe that in the near future, we will be publishing a free resource directory. Would you like to say a little bit about that? It's not on our website yet. It's in the final stages before publication, but what will that have once it's released?
Right. So this resource directory is intended for anybody who works with adolescents or youth, and it has all of the different programs that are available across the state. So that includes outpatient programs, that includes like group therapies that Bradley Hospital offers. It includes counselors that are available at all the different school districts across the state, and it kind of makes it easier when you're trying to refer somebody to the right place. It includes, the phone number, the website, what that place needs as far as referral information, how to send a referral, and all of it in one place so that you're not spending, all of your time Googling and you end up missing out on something. So that'll be coming soon. It should be a great resource for, like I said, anybody who works with youth.
Excellent. I'm looking forward to seeing that. It sounds really helpful to mental health professionals, pediatricians, parents. I think everyone could have that resource directory. I think it'll be available on our website shortly, on Laura's webpage, and there'll be a link that you can download a digital copy of it. Again, it's totally free. Thank you so much, Laura. It was really a pleasure to talk through these things with you, and I hope that anyone who's watching this who has any questions or concerns will reach out to you. Again, Laura has virtual office hours, so you can see her on a Zoom call just like this, and start to work with her if that's what you want to do. Thank you so much, Laura. Appreciate it.
Thank you.
And bye, everyone. Thank you so much for watching this video. Take care.